Breast lift surgery is something that I do a lot of. A lot of my patients are women that are in the ages where they're done having kids. And the question comes up a lot is, do I need a lift? Do I not need a lift? And is an implant going to do the job by itself? Because what most women are afraid of with a breast lift are the scars. And we'll talk about the scars here in just a second. In this video, I really want to kind of talk about what a breast lift is, who needs it, who doesn't need it, and the ins and outs of the surgery itself. Unless you are genetically blessed, chances are if you've had children and you've breastfed, that you'll probably need some form of breast lift in addition to an augmentation if you're looking to increase size, volume, and fullness that may or may not have been present before having kids. So the question is, who needs a breast lift? There are really two groups of women that need a breast lift as part of their surgery. One is women whose breasts have become ptotic, which is kind of the fancy word for saying saggy. And then the other group, and these are the women who tend to get surprised during their consultation, is women who don't necessarily have breast ptosis or droopiness, but their skin and breast tissue have relaxed, and the skin damage and breast tissue damage that happens as a result of the expanding and contracting of the breast tissue over time, that skin becomes loose and kind of floppy, even if it's not directly sagging. In those cases, the lift part of the operation is really more to tighten skin around our implant or to tighten the skin around our fat grafting and prevent future drooping that will happen over time. The quick rule of thumb is that if you stand undressed in front of a mirror, take a pencil and put a pencil in your breast crease. If you can keep a pencil supported in the breast crease, that probably means you'll need a breast lift when we start talking about breast rejuvenation. If you see stretch marks, those are indications that the elastic properties of the skin have been damaged and they can't support the breast anymore. And so when we talk about doing breast lift surgery, it really is an operation that is taking breast tissue, skin, and ligament tissue that has quit doing its job and then asking it to do its job again. And so we really need to make sure that we have realistic expectations in mind and that we're not trying to ask that skin, breast tissue, and support tissue to do more than it really can. So, and the point that I'm really trying to make is that sagging of the breasts, even after a breast lift, with or without an implant, is still going to happen. There's nothing that we're going to do that's going to prevent recurrent sagginess. What we want to try and do is do everything we can to help slow that process down and help to prevent that. The fact that the breast tissue has kind of given up, for lack of a better term, is also why just using an implant to fill out the skin that is empty or sagging doesn't work. If you look at women who have had breast augmentations, and Instagram before and after pictures on any plastic surgeon's website is full of them, most of those patients are very young patients who haven't had kids. Their breast tissue, their skin is still very tight and elastic. And what's happening is we're putting an implant in and the breast tissue and skin are fighting back. They're squeezing down around that implant. And that interplay between the implant and the skin and breast tissue is really what is responsible for a lot of the look that accompanies a breast augmentation. That look can be very difficult to get if our skin is not elastic, if our breast tissue is not really elastic anymore. because then we're relying on your surgeon, me, trying to tighten that skin and breast tissue down around an implant. And that skin doesn't want to stay tight. It wants to loosen. And in the case of lift with implants, we're really having to walk a very fine balance between not tight enough and too tight. Too tight causes complications. Not tight enough causes early recurrence. So there's a very sort of narrow line that we have to try and walk. Now, goals of breast lift surgery. There are really three of them. One is we want to reposition your breast back up on your chest where it belongs. The second goal is we want to reposition the nipple areolar complex, so your nipple and areola, back on the center part of your breast. So we want to get the breast on the chest, we want to get the nipple back on the breast. And then the third thing, which kind of accompanies those two, is we want to reshape your breast. And in a lot of cases of postpartum women who have had kids and are finished having kids, a lot of what we refer to as involutional changes or loss of volume happens in the upper part of the breast. And that's where we want to try and bring volume back when we reshape the breast. For some women, we can actually use your own tissue and augment the upper part of your breast. For other women, you simply don't have enough tissue there to be able to fill out the upper pole of the breast. And so we have to start looking at other alternatives, things like implants, things like autologous fat grafting, where we do liposuction and then transfer fat up to the upper part of your breast. With a lift and implants, it's important that we choose an implant size that is going to get you the volume that you want, but then at the same time is not going to put too much strain on your tissues such that we can't get the kind of lift that we want. We can't get the nipple repositioned because we've put so much volume in your breast that we can't make those movements, and that we don't put so much pressure on things once as we're trying to close incisions that we either have vascular problems, either the skin or the nipple itself doesn't get enough blood and ends up dying, which is a complete disaster, because it means that we have to take your implants out and start all over. And that is fortunately a very rare complication, but does happen. Or the other possibility is that we don't tighten enough, and then we're talking about a breast that is too saggy too early, and we need to do a sort of a little tuck up or a little secondary lift to help tighten things up. When I'm talking to my patients about this specific procedure, a lift with implants, there are really two ways that we can go. A lot of women will bring in pictures of a look that they're going for, which I encourage because it helps further our conversation and make sure that our goals are the same. But a lot of times the pictures that people bring in are pictures of 20-year-old women with a breast implant by itself. And these women have never had kids. And so we're kind of trying to compare apples to oranges. It's still a good idea because we get to talk about breast aesthetics and what is attractive to you and what is possible. One of the big questions that comes up during a breast lift or lift and implant consultation is what type of incisions are going to be used. And there are three types of incisions that are used for breast lift surgery, and they build on top of each other. For what we call the small one is a donut or periareolar mastopexy. And this is an incision that is around the areola. It takes, in cases of women who have very dilated areola after having children or who were just born with large areola, we make the areola smaller, we make them more symmetric, and we're able to do the surgery through those incisions. So in a lot of cases, that's the only incision that you have. Now, that is really for women who need very little lift of their areola and little to no repositioning of the breast tissue. This is commonly used in conjunction with an implant. The medium incision is kind of referred to as the lollipop incision. So it takes that donut, that periareolar mastopexy incision, and then adds a vertical component to it. So running from, in various lengths, from the bottom of the areola down to the breast crease itself. And this allows me to tighten the breast tissue, create a nice shape to that breast, whether or not an implant is being used. That kind of brings me to the third, or the large mastopexy incision, which is what is kind of the standard anchor or teddy bear pattern incisions, where we add a breast crease incision to that lollipop incision. And that breast crease incision is varying lengths. We try and keep it as short as we can, but has to be long enough to allow for reshaping of the breast and for removal of any excess skin and breast tissue in the lower part of the breast that can't be repositioned. Thanks for watching this video. If you are looking for more great content like this, please click on the link up here to subscribe for all of our weekly video. We're always looking for topic suggestions, so if you have something you'd like me to discuss, please leave a comment below or shoot us an email, info@drjasonhall.com. Thanks, and we'll see you again soon.